The most commonly missed lesion which I have in my practice is the fracture of the lateral condyle.
Okay.
So what is the special X-ray which should be done for fracture of the, supposing if I am suspecting a lateral condyle or any elbow fracture, how many views should we take, and should we supervise those views? How should we go about it?
Yeah. So what is very important is that in elbow, in my clinical practice, it is a rule that it can't be just 2 views. It has to be 3 views in minimum: AP, lateral, and oblique. Now that oblique view is something which always needs to be supervised. When we say it is oblique, the technician many a times feels that it is something in between AP and lateral. But there is a very specific way in which to do an oblique view. So what you should remember is that if you have an elbow fracture, the child is going to have a flexion deformity because he's going to be in a lot of pain. So what you should remember is that the distal humerus has to be kept flat on the X-ray plate, and the entire arm should be rotated internally by about 15 to 20 degrees. So what happens is that many times the technician does something different, something oblique, something weird. Whatever it is, he feels that it is something which is in between AP and lateral view. If that is the case, that internal rotation oblique view has no meaning. It has to be a very specific internal rotation AP view with an internal rotation given for the entire arm of about 15 to 20 degrees.